Hey, Colleen and Gabby, I'm not sure who's watching. All right. It's 7:16 in the morning. It's interesting now. I'm more refreshed in the morning and I'm, you know, dozing off to go to sleep at 8 p.m. now. Okay. So the dysautonomia diagnosis. Question: in the recent years, you talked about getting a dysautonomia diagnosis. How did you find a doctor to help you? All right. So, like I said, in 1996, I asked for the tilt table test. I was already living here in Florida, and I went to an infectious disease doctor here. He had an ad in the yellow pages, like Susan Levine did in New York. She's an infectious disease. The only doctor who treats C. fids, right? Only infectious disease who treats C. fids in the area, right? So I went to him, and I left a message with him. It had to be the end of December 95. And I says, I think I need that tilt table test. I really didn't know why, but everybody was getting them. And everybody was getting them. So he called me up and he says, you're not feeling well? I says, yeah. And I was terrible, because it was here in Florida. I didn't really have Susan Levine. She was given those IV Myers cocktails that were fabulous. Part of the appointment. It wasn't an extra charge, So it helped big time. So, he says, you're not feeling well? I says, yeah. So he referred me to the cardiologist, and actually we had an appointment right in the hospital through the ambulatory. And they brought me to the CCU, actually, the procedure room in the CCU to do this tilt table test. And I met the cardiologist, and he was pretty young then. This particular cardiologist just passed away a few years ago here. He says, you have CFID. You've been sick pretty much all your life. I says, well, I got sick easier when I was younger. I was sick a lot. So we do this tilt table test, and it was kind of cool because the nurse there was a male nurse, and he was a CCU nurse, so I felt like I was at home because I had worked in the CCU, 10 years before. So we're doing the tilt table test, and when he put the table up, the blood pressure dropped from 120 to 90 over 50. So it has to. So that's the criteria for OH. My heart rate went up to 140. He didn't, make a deal of that. He said, looks like orthostatic hypotension. And he said, fluids and salt. Now, I was only 31. I was just before I turned 32. When you're younger, they like to treat you conservatively first. So I got this fluids and salt. Actually, these thermotabs became popular. Dr. Bell's study actually got press, and they were talking about how salt improves people like us, right? And these thermotabs, it still says it on here somewhere, chronic fatigue syndrome. They weren't calling it ME yet. So it really didn't work. So I knew it was dysautonomia then. But nobody made a big deal. And I was referred back to the infectious disease and then to the psychiatrist. That particular psychiatrist, I told you about him. He's in North Carolina now, and he actually testified. He knew the illness well. He actually had been a doctor in the military before that at Walter Reed. So through the years, 1998, after that, later in 96, I found my longtime doctor I went to for 22 years in Altamont Springs, which is about an hour and 15 minutes from here. 22 years I drove an hour and 15 minutes for care. All right, and we did I said, what are we going to do about this orthostatic hypotension? And I'll tell you, when the cardiologist said orthostatic hypotension, my thoughts went back to 1983, all right? When I was in nursing school. I was in college in 1983 for nursing. they said to us, watch out for those orthostatic hypotension patients. They fall and hit their head, you'll get sued. Make sure you have your malpractice insurance. So I thought, uh-oh, I'm one of those patients. They really didn't explain the mechanism then, but I thought, uh-oh, I'm one of those patients. So I kept thinking, I'm one of those patients. And what I couldn't understand, nobody, I kept saying, what about the orthostatic hypotension? I mean, this is the sort of response I got. Well, we could try Florinef. And I had a trial in Florinef in 1998. Not successful, all right? And, Dr. Cheney said Florinef wasn't successful with most of his patients. I had a trial in 2007 to humor the doctor, the same doctor that did the 1998, my longtime doctor. I guess he forgot because it was almost 10 years. I says, okay, I'll try it again. No success. And then I had found a local doctor here. My doctor in Altamont Springs was getting up there in age. And I thought, I better get a backup doctor. And actually, there was a doctor right here locally who was also in the CoCure Good Doctor list, the old one. So I had started seeing him in 2012 or 14, 2014. I actually was originally scheduled for a hysterectomy then. I actually backed out. I canceled. But I went to him. He did the pre-op because the GYN doctor, he says, they know me as fibromyalgia. I'm in the medical system here, right, listed. And he says, and he whispers it, right? You have fibromyalgia. He says, you need a medical clearance. When I got the medical record later, I also saw that I was a verified chronic fatigue syndrome patient. I was wondering, how the heck did they verify me? Did they call the CDC? Are we on a list, So anyway, I went to, I became a patient of the local doctor. I figured I'd become a regular patient and I'd have the backup when my doctor in Altamont Springs, Dr. DeLuca, retires, right? So the doctor here, he says, oh, did you ever try Florinef? I said, well, it wasn't successful. But I humored him. I says, okay, I'll try it again. No success. And actually, around that time, I had a torn rotator cuff. And actually, the local doctor, 2012 was the first time I went to him. We were going to do 2012. 2014, I had this full thickness tear rotator cuff, right? This full thickness rotator cuff tear. So we do the pre-op, and the day before the surgery, they called up and said the surgery was canceled. The doctor disappeared. So a few months later, I'm going through my paperwork to go to Dr. DeLuca, actually, and I see the EKG, the pre-op EKG was abnormal. I says, oh, look at this. So I looked and I did a search, and I was looking for a cardiologist with their own private practice. I lean towards doctors that are solo practice, not groups. So I found this cardiologist, and he's the one I have now. He redid the EKG. We did an echocardiogram, and he saw the the medical record, and he says, "You ever try Mestinon or Midodrine?" And I says, "Well," because I also have a diagnosis, chronic hypotension too. Anyway, I said, "Nah, I don't think those meds are going to work." And my mindset was very bad. I was really a doubter, like a lot of us. No, I don't think, treatment for autonomic, issues are going to work. No, because I said the Florinef didn't work. Those meds aren't going to work. And every year that I went to him for almost 4 years, I kept refusing. He would say, "You want some Mestinon?" I said, "No, I don't think it's going to work." "You want Midodrine? I'll give you Midodrine and Mestinon." What, So he knew, and I was refusing. In 2018, the near syncope episode, actually it was 2015, I almost passed out in a Quest lab. They call a 911, chest pain. Take me to the ER. They did all the tests to make sure it wasn't, heart attack. And the ER doctor said to me, he says, "You had a near syncopal episode." I said, "Okay." So I knew what he was talking about. He says, "You need to follow up with the cardiologist." So I knew, the near syncopal episodes were actually increasing and getting worse and worse. I was also walking around with the blood pressure 80 over 50. It felt like hell, increasing hell, and the crash was terrible. I mean, I was down all the time, like a lot of us, right? So anyway, so Dr. DeLuca, he was getting up there in age, and he, was saying the lease was going to be over at his office June 2018, and April 2018, he says, "Oh, you're going to renew your lease?" He said, "Well, no, I'm going to retire." And he said his secretary at the desk, "We'll have a paper, saying why." And the previous year he had cut down his hours, right? Well, when I saw the paper, he cut down his hours because he had bladder cancer, and he was getting chemotherapy, and he had just had this big surgery at the Moffitt Cancer Center in Tampa. They removed the bladder, and his doctors wanted him to retire to convalesce. And he was also almost 81. He looked amazing for his age. You would have never guessed he was 81. So I thought, okay, I have my backup doctor, right? So I get all the records, bring it to the backup doctor, and the local doctor here. Well, 2 months after that, I got a letter from the local doctor. He was closing his practice, that he and his wife didn't take a salary for 2 years, and they needed health insurance, and he had already taken a job out west. He was flying back and forth. He likes ER medicine. So he got a job in the ER in a hospital in Wyoming. So I thought, uh-oh, I'm going to be without a doctor. So the near syncope was getting worse. I thought, I'm going to fall and hit my head like they talked about in nursing school. And this was in the summer of 2018. I was walking around with compression all the way up to here. It was like wearing a straitjacket. I was drinking massive amounts of water with no success. And I, made an appointment with the cardiologist. I thought I'd better, see what he has to offer. I need to do it because I'm going to fall and hit my head here. And nobody's going to find me for weeks. It's ceramic tile, So, and I also started doing some searches. So I knew I wouldn't find, if I did ME, I wouldn't find a local doctor. So I just put chronic fatigue syndrome, and this guy came up. Not far, from the local the local doctor who was closing his office. I said, "Oh, there's somebody here." So I made an appointment with him, September 2013, and that was the time we were doing the workup with the cardiologist. And the cardiologist was the end of September that we started the midodrine, and with amazing results because the mast cell was stabilized with the health coach plan. So amazing. I mean, the first dose of that midodrine, my brain sort of switched on. It's not 100%, but it was amazing compared to what it was. And I had, my dog Tippy was alive. Walked Tippy, and there was no crash after the walk. I thought, oh, the crash was gone. So I go to this new doctor here, the GP that I have, local GP I have now. And he looks at me, he says, "You have POTS." And I said, "No, I don't. I have orthostatic hypotension." He's Italian too, so we're arguing back and forth. "You have POTS." I said, "No, I don't. I have orthostatic hypotension." We're going back and forth. I said, "Well, the tilt table test in 1996, when the table went up, my heart rate went to 140. He said, 'See, you have POTS. See, I'm referring you to Vanderbilt. And I said, no. I have this PTSD. I had this bad PTSD from going to a new doctor because of years of what we went through, a lot of us. No Vanderbilt. I actually didn't say yes to Vanderbilt till about 10 months later. So, he had some records I had from the cardiologist, and right after that, when I went back to the cardiologist, we were adjusting the midodrine, and we were talking about salt, and he said no restriction of the salt shaker for dysautonomia patients. And then like the light bulb came on. I says, oh wow, right, this may have been dysautonomia all along. We really don't know. But so I thought, okay, now this was October 2018. I thought I need to join the dysautonomia group to see who the patients are using here in Florida. I also started watching some lectures. There was a guy, a cardiologist at the Children's Hospital of Philadelphia. There's a pediatric POTS clinic there. And the cardiologist that runs it, he was a conventional cardiologist, a regular cardiologist at first, and he took an interest in this. I don't know if he was a pediatric cardiologist or both adult and peds, but he changed his whole practice to the kids with POTS because they needed he had to do the whole primary care thing, not just the POTS. So I was watching his lecture, and when I was listening to him, it sounded like he was talking about the history of ME. He was saying that, the dysautonomia was known as neuromyasthenia in the 1800s. And he was talking about sleep and antivirals. I thought, oh, wow. So that was October of 2000. I think I sent you that video. His name was Dr. Jeffrey Boris. The pediatric POTS, but it's the same for adults. So I joined the dysautonomia group, and they were all talking mainly, the Florida one, mainly about two doctors, Dr. Trevino and some doctor up in the Panhandle who actually has it. So those were the two popular primary cares with expertise in dysautonomia. And also they have a whole list of specialists, that know autonomic at different centers. When the spring was coming, January, February, the person in charge of the Dysautonomia International in Florida and a few of the others, they were doing meetups around the state of Florida, and Dr. Trevino was coming with them to reach out to the patients, answer questions. So there was going to be a meetup in Winter Park. All right, and I wasn't driving, so I didn't have a car. I thought, oh, wow, I'd really like to go to that. I don't know those people. So the day of the meetup, I message Shannon. She runs the group. I says, I'd really like to go, but this was an hour before, maybe 2 hours before. She says, oh, there's somebody in your area. I'll message her. She can come pick you up. I said, oh, and the girl messages me. I have a new friend now. I made a new friend, and she picked me up, and we went to Winter Park. It's a part of Orlando, Winter Park. It was at the library at Winter Park. And my thing was, I wanted to find out if Dr. Trevino prescribed those antivirals. I need my backup antivirals, right? And he did, but there were all kinds of patients there, mothers with their kids. They were in wheelchairs, feeding tubes. Actually, some of them had that Ehlers-Danlos syndrome, and they were showing us how their hips dislocate. I got the chills when I saw the girl pulling her hip out and putting it back. I thought, oh, I only saw that in the OR. Patients under anesthesia, you did that, not people doing. So he answered a lot of questions. The children with the 504 plan, the parents, they do the IEPs in school for accommodation, homeschool. They went over accommodations. They were even showing samples of compression stockings. I mean, really, I thought, wow, you don't see this in our community. It was really amazing. And, I asked him if he prescribed those antivirals. He said, yeah. And I thought, I'm going to make an appointment, and there was a month wait for a new patient then to make an appointment. And it was really nice. The new friend after that, we went to eat. We went to there's a big health food store there. It was really nice. So I have a new friend, and actually she's a member we have a local dysautonomia group here that I didn't even know. The one that I invited you to the group of, Dysautonomia Determination. And I met all of them, and we had some get-togethers. Very nice. Never had this. I had no idea there were many other patients here. So anyway, I make that appointment with Dr. Trevino a month or two later, and I rented a car, and I drove 3 hours to see him in Clearwater. And I'll tell you, when I got to the Tampa Bay area, I hadn't been over there in 20 years. I thought, oh, wow, I forgot how beautiful it was. I pulled over, took pictures. I go off track, right? So when I went to Dr. Trevino, all right, I had 24 years of medical records. I was booked for a 2-hour appointment. He sees all the paperwork. He says, you're a patient longer than I'm a doctor. You can tell me what to do. So I ended up only seeing him an hour, all right, because I was already diagnosed. He upped the midodrine. I was on 5 milligrams of midodrine 3 times a day. He upped it to 10. Also prescribed the mast cell protocol. He also wrote it down because there's a few things you buy over the counter. And he ordered the IVs. And it took about a month to get that set up because I had to change my Medicare plan to an Advantage plan so the out-of-pocket wouldn't be so high. And actually, I think the diagnosis code is something to do with hydration. All right, so the diagnosis codes go by the symptoms, not ME or, fibromyalgia. Okay, though, fibromyalgia and chronic fatigue syndrome, those are definitions. We know that. It goes by the symptoms. All right, so I believe it's a hydration or something that they use. And the billing person, I know the three of us, I was on the phone with the billing person and the insurance company, and they had to do a few other things. And the guy from the insurance company was telling her what codes to do so the insurance company would approve the IVs. So, and I believe it's all hydration related. So I finally got the IVs after, 25 years of waiting. Actually, at least 23 years at that point waiting. Right. So, and then we did appointments. I know I had a couple of appointments with him a month apart. And that fall, the midodrine was great. Although I had to add a 4th dose because I was up and walking. It was amazing. The IVs, I'll tell you what the IVs did. The IVs, when it started the IVs, I was walking with my dog Tippy. She was terminal. It was like 90, 100 degrees. And I was walking her out there. And the IVs were like changing the oil in the engine. It was like fueling the engine. It was absolutely amazing what the fluids did. I was walking every day, but the fluids, I was able to walk twice a day. And no crash, still no crash. It was absolutely amazing, the difference what the fluids did. And I thought, oh, wow. And I knew through the years, when Dr. Bell did his study, and there were patients who were on fluids, and they talked about how much better they did. I says, oh, wow. I said, patients would have had a better quality of life, even with just the fluids. They'd be able to sit up. They'd be able to walk a little bit. It's amazing. It also, I'll tell you, it helps clear up mast cell flare-ups. Amazing. I had one earlier this week, and I ran those fluids overnight. I had the IV. The nurse comes. It pays the home care nurse comes and puts the IV in, and I says, I'm having a reaction to that medication the pulmonary doctor prescribed. I knew it was a mast cell related thing. So when I got up in the morning, it was amazing how much better I felt from the IV. So it's amazing what the IVs do. It's amazing what a liter of saline does. And, patients should have had access to this all these years. I'm a storyteller, Colleen, right? We all have a story. So that's how, okay, on the medical record, okay, ICD code, it's down. Now I have the neurogenic version of the orthostatic hypotension because it's dysautonomia. There's a difference between cardiogenic and neurogenic, but it's down. The ICD code is orthostatic hypotension system, and it's a G90.3 ICD code. And then there's a bunch of other, at this point, I have a whole list. They don't take off the old ones. And I also, that my dysautonomia diagnosis, actually, I do meet the criteria for POTS, but it's not as problematic as the OH, neurocardiogenic syncope, and chronic hypotension. Those are, and let me say, mast cell is considered, they know mast cell is part of dysautonomia, mast cell, MCAS, MCAS. Okay, actually, the next question is, how many years have you been sick when you learned about what you have and started treatments that have improved your quality of life? So I'll do that in the next video, okay?